Our research project is on compassion fatigue in critical care nurses. Understanding compassion fatigue is a newer concept that is gaining more ground in the nursing field. The concept of compassion fatigue is being promoted more frequently in healthcare workplaces to reduce the amount of burnout experienced by nurses. Compassion fatigue term was first coined in 1992, and it describes a unique form of burnout that affects caregivers, resulting in a loss of ability to nurture. Compassion fatigue occurs when nurses develop declining empathic ability from repeated exposure to others' suffering, high-stress environments, and the continuous giving of self. It involves physical and emotional drain on how healthcare providers function, as well as psychological factors affected by compassion fatigue, such as anxiety and depression. Compassion fatigue can halt the perpetuation of empathy, causing erosion of nurses' mind, body, and spirit, and all nurses in the field are at risk for compassion fatigue. Without recovery, nurses may view leaving the profession as the only way to achieve catharsis. Critical care nurses are often exposed to higher levels of stress and traumatic experiences, which puts them at even greater risk for developing compassion fatigue. Conceptual clarity is vital to curtail compassion fatigue via preventive and restorative measures at the individual and organizational level. Interventions to combat compassion fatigue are being implemented to improve nursing psychological well-being and create higher retention of nursing staff. This is true in areas such as critical care nursing, which is known in the field for higher burnout and more issues in retention, and that's also related to higher rates of patient mortality. Evidence shows that prevention of compassion fatigue is achieved through professional boundaries, self-care measures, self-awareness, and education on the concept at the individual and organizational level. The PICO question of focus in our study is, in critical care nurses for dying patients, how do organizational strategies addressing compassion fatigue compared to lack of organizational strategies impact staff retention, burnout, and psychological well-being following 1 year hire? The first year of working as a new nurse can be stressful in and of itself without added stressors that may be present. With exposure to many dying patients, as a new nurse, there is higher likelihood for burnout and lack of retention of graduate nurses. Studies have shown that this feeling of burnout and lack of retention among new nurses is related to their psychological well-being, as it is affected by workplace environmental factors related to high levels of stress and traumatic experiences exposed in the workplace. It is imperative that critical care nurses develop conscious awareness as a basic prerequisite for stress management and enhanced resilient behavior. Effective coping skills entails accurate perceptions, knowledge, courage, and cognitive appraisals so that critical care nurses can confront different situations in which they find themselves. The aim of this study is to address whether healthcare organizations who have systems and programs in place to help prevent compassion fatigue for their nurses have proven to be effective and how it may be better implemented in the future. Analysis will be made on the prevalence of compassion fatigue and specific factors related to compassion satisfaction, fatigue, and burnout to identify factors that influence their prevalence. The goal of this study is to analyze current research related to compassion fatigue as it relates to nursing burnout, retention, and psychological well-being, and gain knowledge on which interventions are currently in practice to combat nursing fatigue. Focus areas then are psychological well-being, burnout, and retention. With psychological well-being, caregivers have empathy for patients that they develop secondary trauma, often relating in PTSD, anxiety, depression, and suicide. And with burnout occurs when emotional exhaustion is experienced due to increased workload and institutional stress. Retention: without recovery from compassion fatigue, nurses may view leaving the profession as the only way to alleviate their stress. The methods, so CINAHL, PsycInfo, and PubMed was used to compile research articles with limiters of full text, peer-reviewed in the last 10 years, available in Moravian database. And over 500 articles were retrieved, and out of those, 50 were reviewed further. And the ones included in our cumulative research extensively were 15 articles 10 of those were quantitative, level 4 evidence, and 5 were qualitative, with 2 level 5, level 6, and so research clearly demonstrates that compassion fatigue is existing in critical care nursing and needs to be studied more extensively, and now we'll talk about some of the more specific results of the studies.
Critical care nurses experience high exposure to strenuous conditions correlated with ill effects on psychological well-being, including depression, anxiety, and in some cases suicide. The nurses face higher demands in critical care, which leads to higher fatigue and lower retention. Patient care quality could also be compromised. Nurses might develop emotional trauma due to stress, leading to mental breakdown and reduced capacity to perform at the highest level, and they may even develop PTSD. Some nurses might quit, which affects retention. Some effective strategies include meaningful recognition, appropriate staffing, and decision-making that will help to reduce burnout, moral distress, and trauma. The goal is to promote job satisfaction and a positive work environment, therefore leading to a reduction in fatigue. Nurses work with themes associated with retention, including emotional distress, empathy, resurfacing personal loss and secondary stress, unrealistic expectations on the nurse, detachment, lack of education, and self-care resources. Awareness of this fatigue is a requirement for stress management and enhanced resilience with effective coping skills. With regard to implications, prevention of compassion fatigue can be achieved through professional boundaries, self-care measures, self-awareness, and education on the concept at multiple levels. To address well-being, burnout, and retention, hospitals and other organizations can mitigate nurse workloads, change nurse-to-patient ratios, allow more group therapy discussion for colleagues, and provide more support resources outside the work setting. Other initiatives include self-care education, mental health and preceptor support, mentor relationships, meaningful recognition, and better understanding of personal characteristics. Further research is needed to develop even more effective interventions that will reduce psychological stress and burnout as some nurses leave the profession.